Hello, everyone. We are here right now with Rebecca Cacayuran, who is the Vice President for Community Investments with the Evanston Community Foundation. And then we also have Audrey Thompson, who is the Community Service Manager for the City of Evanston. And we are here to talk about the Evanston Care Network. Rebecca, I'm going to start with you first. Could you tell us what is Evanston Care Network?
Evanston Care Network is a collective initiative of the City of Evanston, Evanston 311, Evanston Public Library, Amita Health, and the Evanston Community Foundation. And we came together in April, I believe, to build out a resource hub, if you will, a coordinated point of entry so that people in Evanston could be able to access the resources available to them in Evanston, whether they're programs through local government or through nonprofits or our local businesses that have really pivoted to be able to meet the needs of Evanston residents. So it's evanstoncarenetwork.org, where people can go to look up resources available to them, and they can also, and it's available in more than 100 languages on evanstoncarenetwork.org, and they can also pick up the phone and call Evanston 311 and to be able to access those resources as well.
Awesome. So Audrey, question for you, what is your involvement in the Evanston Care Network?
Well, since I really work with older adults and I work with youth and young adult, I think that many times residents get to my extension because they're looking for resources. And so I sit on several committees post-COVID. And so, sitting on all of these committees, we really recognized that there were a lot of resources. But people didn't know where to find those resources. So as we continue to talk and get new subcommittees, we thought, hey, we've got to figure out a way that individuals can, if they can't get in contact with me, if they can't get in contact with someone else, they are able to call one place. It's like more of a one call that's all type of resource where individuals can say, hey, I'm going to call 311. Or I can go on the Care Network myself and kind of surf and figure out. So because I am really managing many community services programs, it's just very important for people to be able to find resources, not only for the city of Evanston, but also wanting them to be able to find any other organizational supports that they need.
Awesome, thank you. So how exactly do residents use it? And either of you can answer this question.
So either they can go on the Evanston Care Network and just surf. They can put in, they can just put something into the search bar, or there are different tags that they can click on to find specific resources. What's really different about this resource is that an individual can call 311. And they will use this coordinated resource guide to find resources for an individual. But let's say that a person is just having some difficulty either navigating the resource on their own, or, you're calling 311 and, they're not a social service organization. They're just really looking up a resource and giving you a phone number or a website. So if someone needs additional services, they will be transferred to the Evanston Public Library, and there's a resource librarian at the reference desk that will be able to look at the Evanston Care Network and really help guide them through. So there are just some other questions sometimes that you need to ask an individual to really get to the crux of really what they need. And the reference librarians are able to do that. So that just gives a little bit more triaging. And so we've got a few different, I guess you would say, areas or steps or levels where the person wants to look on their own, they want a little help, or they need even more help than what 311 can provide. So that's what's really unique about the Evanston Care Network.
Awesome, love it. So I know we touched a little bit about, the collaboration to make this happen. If we could just talk a little bit more about how it came to be, whose idea was it, and the organizations that came together to create it. And then again, throwing it out there to either of you.
I think, again, because we've all been on these calls together, we have a not-for-profit task force that was created when the COVID crisis hit. And we're all on these calls. And so I think it came to be really with us just saying we needed a coordinated point of entry. And so we created a subcommittee, and, we thought, who needs to be a part of this? And so I think it just kind of came together pretty seamlessly, enough for us to be on the phone. We threw a lot of things on the wall, and there were some things that stuck and some things that didn't. But I think it's been a real collaboration, even to naming it the Evanston Care Network. So I think we all, I don't know which one of us came up with what. I think we just kind of kept working. That's it, that's the one.
Yeah.
And so I feel like that's what happened that created the whole network. And I think, again, we say this all the time, that so many amazing things can just happen when we work together. And I think the Evanston Care Network is an example of that.
Absolutely. So why is it important now during the pandemic, the Evanston Care Network that you guys created?
I think it's incredibly important that we work together to be able to pull resources together when people are in crisis, right? I think we're finding over and over that despite our best efforts, when we work independently from one another, people fall through the cracks. And if we can all work together, it's just so much more seamless. So you asked about the collaboration. The most recent addition to this collaboration is Amida Health. Mm-hmm. And with Amida Health, we're able to provide to the community, we being just the collective we, Evanstonians have access to a 24/7 crisis line. So when they're dealing with trauma or in the throes of grief, they can call 24/7 and talk to a counselor at Amida Health. And Amida Health has been trained on how to use the Evanston Care Network. So sometimes just getting that tangible support where they're able to access, be placed in, to be able to access rental assistance or whatever's keeping them up at night, they're able to access that. So the more connected we can be, the more we can communicate. We are, as Audrey said, a resource-rich community with incredibly giving people, and also people who just have really great ideas. So the more we can connect people, the better.
And Kemone, you really asked, why now? And I think Rebecca can probably attest to, this is something that we've always needed. But sometimes it just takes a crisis for us to kick it up a notch, And I think that we were all in crisis mode, and it really just helped us to kick it up a notch and say, hey, let's go. And so from that, I think that when there's a crisis, how you come together really is a true testimony as to what community you have. And I think we have a fabulous community. And I think, again, that the Evanston Care Network is proof of that.
Absolutely. And yes, so you touched a little bit on my next question by saying this is something that, we always needed. Because I was going to say, so how does the future play into this? Since it was kind of created out of a crisis situation, is this something that you guys are going to continue? Do you see it changing in the future?
Oh, absolutely. Yes. I think we have really discovered so many additional networks and collaborations that we're working on even something in addition to the Evanston Care Network that we're hoping will be a part of it, because we're also noticing that there are people who are just socially isolated. And so being able to, contact someone for a resource, and then also being able to contact a crisis line, someone that works at the crisis line for assistance, is the additional parts of this. So we know we have to continue it. It can't stop. And so, we tune in every week as the Evanston Care Network subcommittee. And I don't see that changing for anytime soon.
Yeah, as Audrey said, this is something we built during this crisis, but it is designed to live on in the community, in a sustainable way.
Awesome, absolutely. And so I know we went over a little bit about, well, not a little bit, but, the main focus is this is something that, helps people in the community that are going through crisis within COVID. So as you may know, Rebecca, my organization, Evanston President's Future, is on that site and my Teen Mom program. And for me, being a small organization, that helped my outreach. So, and that was really important for me to have, my program there, just in case there were teen parents that, met that qualification that could get in my line versus a longer line potentially, for the same service, because I serve a very specific niche. So I think, this is an awesome, opportunity for someone who may have created a small program to be a part of that. So who are all, you probably don't know all the organizations that are kind of like a part of the umbrella, but if you could give us a couple names of organizations that are under the umbrella of the Evanston Care Network.
Sure. I mean, this is a cross-sector partnership, right? So the programs that are run by the city of Evanston are listed, each individual program. As you said, Kemone, nonprofit programs, whether they're run by large nonprofits or smaller nonprofits or even community groups are listed, and as well as for-profit or businesses. So, for example, we have a number of businesses that have risen during this crisis to really serve people most in need. And so those businesses are listed, like Jennifer's Edibles and Soul and Smoke, C&W Food Pantry. And really the amazing thing about this is that the programs themselves, the organizations themselves, manage their listing. They're the ones who keep it current. And so part of this collaboration has been is really training the community on how to keep this directory updated on their own. And also not only to list their program, but also we encourage them to update their capacity on a weekly basis. So as you said, Kemone, people can go and see, what programs are at capacity and what programs are able to accept additional clients.
Absolutely.
So another part of that is, you find resource guides that are written in paper form all the time. And then something changes. We don't have that program anymore, or we add another program, and it's like, oh, it's already in a book. So now with the Evanston Care Network, as Becca said, you can go on and change it, update it, remove things. I mean, it's so easy. And it's also, you can also have it on your cell phone. So people are able just to pull it up under the Evanston Care Network. So, and look at it on their cell phone. So I think those are all great benefits.
And you can tell we've been working together for a long time because we keep piggybacking on each other. But I want to add that it's completely confidential. that people can filter and enter their information, so their income level or their citizenship status, and they can search for programs that are available to them. It's available in 108 languages. And so really, when we looked at bringing this coordinated point of entry, we wanted to find a way to be able to make it as user-friendly as possible and to eliminate as many barriers and to preserve the confidentiality of our neighbors. So I think that's what we've built together.
Yes, absolutely. Well, I think that is all the questions we have, ladies. If you would like to leave us with anything else, please do so. Please let people know where they can go to look for these services, and let organizations know where they can go if they would like to be a part of the Evanston Care Network.
Mm-hmm. Evanston Care Network. You want to tell them how they can reach us, Becca?
Yes, evanstoncarenetwork.org. If organizations want to learn more, if they want some assistance in getting up onto the platform, they can reach out to the Evanston Library, and they have been providing supports. And then Evanston 311, dial 311, and they can help you as well.
All right. Thank you, ladies, so much, and enjoy the rest of your day.
Thank you.
Thank you, Kemone, so much for having us.
Yeah.